Good morning and welcome to this IDMP session on COVID-19. Before we start today's seminar, I actually wanted to take the opportunity to make a few comments, as today is actually the last seminar that we have planned in our special IDMP series on COVID-19. I want to thank everyone for joining us these past 8 or so weeks every Friday morning. As we talked about this really unprecedented time, hearing perspectives from experts ranging from epidemiology and public health to the biology of the virus and discover remdesivir, from lessons that we should have learned from SARS-1 in China to the more recent experiences of SARS-2 in Seattle and in New York. As many are now, cautiously beginning to shift into a mindset of a slow ramp up to some normal activity, we're going to take a short break from these IDMP seminars around COVID-19, and then we're actually going to return to our normal program meetings. However, COVID-19 is obviously far from over, and it's not even clear that we can even begin to say that we're beginning to approach the end of the beginning. We're all going to have to watch this very carefully. But I do want to let folks know that we still intend to have additional COVID-19 talks scattered through our usual program meetings, and we'll make sure that we alert folks that they're happening through Talks at Broad if people continue to be interested in this pressing topic. We've actually had several folks where we scheduled them to talk about COVID-19 science, but they actually had to cancel just because they were overwhelmed with commitments and the actual work they were doing on the pandemic. And so we're going to try to fit them in the coming months. I also want to add that I think that this unprecedented time has really served to highlight the importance and impact of infectious diseases in the world. So, we appreciate everyone faithfully joining us here when we're discussing COVID-19, but we would really welcome folks to consider continuing to join our regular IDMP meetings every Friday, where we talk about many other infections that also continue to threaten the world. So really thank you for joining us on this journey, which is far from over. So with that, I think I'll turn it over to Robi Bhattacharya, who's a associate member in our IDMP program, and he's going to introduce the speaker and actually moderate the session. Robi?
Thanks, Deb. I'm really excited to introduce the next speaker in the series, and a reminder that you can submit questions in the Q&A function on Zoom as the talk goes along, and we'll try to field them as many as we can towards the end. So I'm really thrilled to have Alexis Madrigal joining us today. Alexis is a staff writer at The Atlantic, where he writes about science and technology, and until recently had mainly covered Silicon Valley and the ideas that animate that ecosystem. He created and hosted Containers, a documentary podcast about how trade remade the economy, and Real Future, a television series about the human side of technology. He's also been editor-in-chief of Fusion, a staff writer at Wired, and a visiting scholar at UC Berkeley's Information School and Center for Science, Technology, Medicine, and Society, and an affiliate of Harvard's Berkman Klein Center for the Internet and Society. He's the author of a book called Powering the Dream, The History and Promise of Green Technology, and is finishing a book about environmental justice. But like so many of us in the past few months, he's pivoted hard towards COVID. And he's here today to tell us about his efforts in co-founding the COVID Tracking Project. So without taking up any more of your time, I'm thrilled to turn this over to Alexis Madrigal. Thanks for joining us this morning.
Great, thank you for having me. I am joining you live from the West, from Oakland, California. So if you see a small child wander into this room, you will know why, and we'll get going. I mean, the first question I think for a lot of people to answer is just, what is this COVID tracking project? You may have gone to it, you may have seen the website at covidtracking.com, or you've seen the data referenced somewhere, Johns Hopkins tracker, somewhere else. And it's a good question because the COVID tracking project did not actually exist before the month of March. And I want to provide in this talk a little bit of background about how this project sort of came together, what our methods are and how it sort of works, the impact that we've had, and what kind of journalism this really is, and what we think this kind of data journalism can do that perhaps other forms of journalism cannot. So the COVID tracking project, our mission is to compile and publish the highest quality data that's essential to the understanding and responding to the COVID-19 outbreak in the United States. In practice, what that has really meant is gathering data from the states and compiling it into national data through time, creating a time series on testing, hospitalizations, deaths, cases, and increasingly a wider variety of things, including just how are states reporting, just what's the comprehensiveness of state reporting, as well as tracking demographic information that's attached to patients, to deaths, and in a few states even to tests. So this data has only been available from the COVID tracking project until this week. It just didn't exist. We also knew that data alone would be inert. I mean, one of the lessons that I have from my work, working with an environmental justice leader here in West Oakland named Margaret Gordon, is just that, data on its own does not always have impact out in the world. It's easy for it to be sort of inert. And in order for the data to actually have power, people have to use it. People have to find it useful. And so from the beginning, in addition to providing the data, our other goal was to sort of work on this network and support the network of people that were sort of both decision makers, but also people trying to understand these decisions, people who need to have the highest quality data possible, understanding all the caveats for these things, in order to make decisions about their personal lives, about their businesses, about governments and everything else. And that's really informed a lot of the way that we've actually built this little pop-up institution, was to remember that we wanted to maximize value to the edges of the network, that we may be a central node because the data is sort of flowing through us, but we want to make sure that the local papers that use the data all across the country, the modelers who use this data have the kind of access they need and the sort of things that they want. And so we tried to build relationships where we didn't already have them among data users. So how it works is we have volunteers. Now, 650 people have contributed in some way. People have come in and out. Some people come in really, hard and fast and work really hard and then go, wait, I got to go back to my real job. Some people are, metronomic volunteers who are there just every day for a little while. And some people have basically pivoted their whole lives to working on this project. We've recently begun to pay some staff, as contract people who are doing this work. And yeah, that core is about, 15 people. And then the sort of next group out is about, 70, 75. And it's sort of housed within the Atlantic. So, the official name of the project is now the COVID Tracking Project at the Atlantic. And the reason is I work there. I'm a staff writer there, as Roby said. And it sort of, as you'll see, kind of came out of a collaboration between Atlantic folks and a data scientist and bioinformatics guy called Jeff Hammerbacher, who some of you may know here. This is the sort of core output of this group, is this data set that tracks different things, testing and outcomes and hospitalizations. I should say for this group, like, the data quality between these things is highly variable. The positive tests or cases tends to be pretty high quality because of the reporting requirements. Negative testing it varies by state. It's pretty good now, at least we think. And the big lever on the quality of that data was when commercial labs started to report to states the results of all tests, not just positive ones. Hospitalization data is extremely spotty. Some states report well, some states do not. The biggest problems in this data set come when there's two right ways or more than two right ways of doing something. So one set of states reports one way, another set of states reports another way. And when that happens, we have a really hard time producing summary statistics. So the best example of that is in hospitalizations. Let's call it 2/3 of the states report cumulative hospitalizations. That's interesting for understanding the severity of the outbreak and what's happened in a particular state, but it doesn't tell you much about the load on the hospital system at any given moment. A lot of the big outbreak states actually just report current hospitalizations. The real problem is that you can't combine those numbers. They're fundamentally different things. So people often ask us, well, if you guys are collecting all this data, how many people have been hospitalized in the United States from COVID-19? And we're like, don't know, can't really tell you that. And I think that's been frustrating for our team. I think it's been frustrating for a lot of people who are really looking to understand how this outbreak has played out in the United States. And there's a few other things like that. Some states report people tested, other states report specimens tested, and that creates sort of mixed units in our overall summary statistics. In that case, we don't think it's as big of a problem. In the 5 states that do report both specimens tested and people tested, we find that the ratio is like 1.1 or 1.2 to 1. So it's a problem, but directionally things line up. Increasingly, aside from sort of the core data set, people have asked us, like, how do we evaluate and understand the quality of this data? Like, how do we know how well to trust what's coming out here? And what we ended up doing was creating this spreadsheet here, which sits behind the site. And we go through twice a week and we update the way that every single state and territory in the District of Columbia is reporting their numbers. So we created a rubric of comprehensiveness. The blue that you see here is actually scored in the letter grade, but then there are other things that are obviously of interest that we want to be able to also track and understand. So that's everything from sort of hospital capacity or the kind of line list to, what do they tell us about healthcare workers or people, working in plants or, prisons and corrections, long-term care facilities, things like that. And this in and of itself is an enormous amount of work. It's sort of like a side output, but it's also the kind of thing that's more or less impossible to maintain for probably anybody but the very largest newsrooms. Maybe the New York Times could maintain a list like this. Maybe some people at the Kaiser Family Foundation could maintain a list like this, but by and large, there's almost no organization that's kind of set up to do this. It's really easy to do once. Everybody can kind of go through, but how do you do it day over day? How do you do it week after week? And how do you make sure that the decisions that everyone makes as they make these kind of encodings continue to be congruent? And this is kind of like the big problem in general with this kind of hand data collection. You have to sort of build a whole system around the data collection. It can't just be, snap sort of intuitive decisions about the quirks of each state, because one thing we've learned, the joke is that every state is an edge case. It's like there's just it's all edge cases, that's it. And the way that every state reports is slightly different, and every single data run, some state changes something about the way that they report. So in the early days when we were providing very simple guidance, we were changing things 10 times a data run about the way a state was reporting. And we've actually brought down the frequency of updates precisely for that reason. It was harder to maintain replicable decision-making processes the more runs that we had. If there was one run in the middle of the day that everyone who was really deeply involved could see the outputs of and decision-making logic that was going on, it allowed us to replicate our decision-making more effectively. It's really, really, really important. This is sort of the newest thing that we've been tracking. I'm showing you here a future launch. This is like a comp of our new racial data dashboard. And it'll sort of, there's obviously a lot more to it than just what you see here. This is the top. But we have begun tracking the way that states are reporting race and ethnicity. Of course, this is important not just for the sort of affected communities here, but we really believe, in my journalistic part of my brain, that this is really important to understanding the outbreak overall. And all you got to do is look at the meatpacking plants in the Midwest if you want to see why that is. This is a collaboration with the Anti-Racist Research and Policy Center, which is led by Ibram X. Kendi, who's another Atlantic, he's a contributing writer at The Atlantic, and his staff has been amazing. Rachel Lee, Christopher Petrella have been really helping us drive this project forward. And it's, this is, if we thought the data was bad for many of the other things that we've been tracking, the data is worse for race and ethnicity. And so we've been working very hard in this part of the project, not just to gather the data as it exists from the states, but to do outreach to those states and what we're calling data advocacy to help guide them to the right decision, which is to share more data and to share more effectively. Because, one of the problems that we have is in some cases, we will show a huge disparity. Let's say African-Americans are dying at 2 or 3x their proportion of the population. But the number of unknowns in those deaths is like 20%. Or in cases, it's even more extreme. In many cases, members of my community and Mexican, the Latinx community, are testing positive in the 3 states where we have that data. 1 out of every 2 people who is tested, who is identified as Hispanic, is testing positive, in these 3 states. And we don't really know how to interpret that because there's so much missing data. I mean, we know a little bit how to interpret that. It's certainly, from a journalistic perspective, a giant red flag saying, hey, you might want to look into what's going on in this particular community, their access to healthcare and the severity of the outbreak in this community. I mean, that is 100% the case. But it doesn't tell you everything that you need to know. And we know that that data is not complete. And we know that a lot of that is actually being lost at the point of care. So we're working on that as well. There's a lot to we realized just very early on that we could only capture what the states reported. That was both our methodology, and it was the only thing that kind of made sense. Nobody else is gathering the data in the way that the states are, which meant that if we wanted more complete data, we needed to put pressure on the states to provide it. And that's been a part of the project that has grown increasingly important as time has gone on. And of course, there's also fraud, because we know that state public health departments are doing the best that they can. We know people are working extremely hard. And of course, if you had to choose between a great response and generating data about that response and sharing it with other people, you would choose a great response. I think the problem is, and I think, all you got to do is look at social distancing measures that we have, the location data there, the actual orders from the state have a major impact, but the people of every state are in large part determining how much they're going to move around, because we're not enforcing this like later Italy or like China or other places where a lockdown is actually truly a lockdown. I mean, what we have here is something different and much softer and much more dependent on what people are doing, what people choose to do. And so because everyone is part of the response, the data should be available for people. And, I'm going to show you in the impact section of this in a second, but many key metrics just have not been available from anybody else, and including our national authorities. So here's what we really believe, and then I'm going to tell you a little bit about the origin story. I mean, we believe in being a force for reality and a shared reality, which means we want to close gaps between what is happening in the world and what the data reflects to the extent that we can. And this really guides a lot of our decision making. Data quality has to come first. We are not trying to be the fastest tracker. We're not trying to be the most, to track the most things. We track what we can attest to the quality of. And that has always been our guiding light. We have maximally open data with industry, government, media, everybody else. If you're not familiar with the news industry or media, it's extremely weird for an organization housed inside a media company to be open in this way. But we have thought it was important from the very beginning. And because it sort of started as a semi-rogue project, because we thought it would be over so soon, we developed some sensibilities and principles that are maybe a little bit outside the journalistic norm, or really the media norm. I think most journalists are pretty committed to sharing openly. We also really believe that this data should be used responsibly, and that we have to both demonstrate and help people understand what they're really looking at. We saw a lot of really poor uses of the data very early on, and lack of understanding about its state of completeness. And so we have really taken steps to try to change that. And the last thing is, we really want our volunteers to have a really inclusive and healthy and supportive environment. And that's been really crucial as a pressure cooker of a project and of a time. And having a more diverse group, having gender balanced teams, gender balanced leadership has helped us helped avoid a lot of communication problems that plague collective projects like this. Here's our team. You see Jeff Hammerbacher. Another person I just want to shout out is Aaron Kassane. I don't know if anyone here watches Miyazaki movies, but if you've seen Nausicaa of the Valley of the Wind, a pretty incredible movie about a superhero whose superpowers basically are empathy and communication with all creatures. That's Aaron, basically, and has, in addition to being sort of a brilliant journalistic mind, is also just an amazing manager. There's a bunch of different people here, but I just want to particularly call out the people on our data entry team, Elliot Klug and Prajakta Renati. They have worked so hard. They've organized so many people. They've dealt with so much bad data. They're just been just heroic efforts. And of course, our heroism's not much on the scale of, frontline workers, healthcare workers. But to the extent that we support those efforts by putting out this data, people have really taken on that burden and taken on, really turning their lives upside down in order to be able to do this. Almost everybody you see here has children. Team is much larger than that. One just great story. You see Andrew Schwartz there. He came in and was working, extremely hard. We had no idea who he was, but his GitHub looked good, and the other coders were like, "Yeah, this guy's great," So he comes in, he does this incredible run of work, just works like day and night for weeks, and then he posts on the Slack at one point, "Hey guys, I gotta take a step back a little bit, and the reason is I need to finish high school." They've come to do virtual classes, and of course, the big responses to him were from like Ethan Marcotte, who, the idea of responsive design, that is like what shows up on a little phone is different from what shows on a big phone, but a big computer or an iPad. Like Ethan is the guy who came up with that idea, and he was just working without even knowing it, hand in hand with this kid who's a high school senior in Boulder, and it's one of the glories of one of these projects, and kind of makes it, in this really hard time, rebuilding some of this, feeling of the 90s internet, and that, we're all in this together, and this platform can actually serve to create these new types of communities that are necessary to kind of, as our governor here in California says, meet this moment. That sort of thing is still possible, that outreach team that I mentioned earlier tries to get, and reporting tries to get better data out of the states. You can see their really diverse team from, journalists, comms folks, and data scientists, and our program and product management team, also more from the tech side and the design side, but just fantastic people all around. We also did build an advisory board because most of our expertise lay outside the particulars of virology, epidemiology, and other things. And we are really proud of this board. These people have already been extremely helpful, and we look forward to continuing to use them as a sounding board, make sure that we're making sound decisions, keeping to those principles that I talked about, and doing the right things. So fun kind of origin story. Normally you do this part first, but I wanted to just tell you what we do for those who are extremely busy and need to log off. This part's fun though, I promise. Well, fun for certain definitions of fun, but this is really the beginning. Robinson Myers, another reporter at The Atlantic, and I, we were working on we were working on COVID-related stories. And one day, it was March 4th, actually, I remember it was the last day of the before times for me. Rob called me, and we've been talking about how bad it looked like things were about to get. And he was like, imagine that we're reporters on the Army Corps of Engineer beat, 5 days before Katrina. Like, what are we doing? Like, why aren't we just like working 24 hours a day and going, trying to expose this before it blew up? And Rob, and I want to give all the credit to him in this, he really honed in on, wait, testing is the problem. And the most important number in the world right now is how many Americans have actually been tested, because everyone at this point in time was talking about how few cases the US had, how few deaths relative to these other places. And we realized, wait, if we haven't tested anyone, then we don't have any cases. And it actually hasn't been long enough for people to be dying in large numbers. So we have no visibility on the nature of the outbreak. So we just started going to state websites and calling state health departments that night, continued through the night and over the next few days until we published this. We created a spreadsheet which had all those things, and we were able to show that less than 2,000 Americans had been tested up through March 6th as a result of a variety of failures, largely inside the government. Even just yesterday, Senator Romney used that number and this reporting to talk about the early testing debacle and the botched response within the administration, which I think is pretty indisputable if you look just at the facts of what happened. But you need numbers to pin that kind of problem down. Otherwise, it seems like you're just, it's just like partisan rancor. You're like, well, okay, was it a good or bad response that by March 6th, we'd only tested less than 2,000 people? And it's just indisputably a bad response. After this story published, I got an email from an old friend of mine. Said, thanks for writing this up. This is from Jeff Hammerbacher. I'm curious if you use my spreadsheet to help track this data. And as you can see, my very high-level response, holy shit, I wish we had. We made this one, which is a lot messier, which includes media reports, conversations with health officials. And we had also gathered testing capacity data, which was terrifying. At that, on March 6th, some states had the capacity to test 5 people a day. So when this happened, Jeff and I have been friends since we were freshmen at Harvard, actually. We would go hang out in Dunster, and other places through the years. We just met each other maybe even before college, maybe on pre-fresh weekend or something. And have kind of fallen out of touch, but, we're still friendly and, gone out across the different cities across the nation as we ran into each other. And we decided pretty quickly to join forces and to gather some volunteers to try and make this thing go. First volunteer was Erin Kissane, who's a really good friend of Robinson Myers and someone I've known also on the internet for years. And she became sort of the third early co-founder who's kind of working operationally on the project. The first release was literally this spreadsheet, looked kind of like this. And well, it looked exactly like this, but this is from March 16th. As you can see, when we were really getting going, you can see, March 6th when our story published, the positive and negative reported tests were 1,840 total. There were some deaths in the US at that point, but the states hadn't reported them. We hadn't logged them yet. So you see it's pretty incredible how small the numbers are there, knowing what we know now. But this was also, our early release, and the process for us actually has been exactly the same, more or less, since then. It's become more rigorous. It's become more battleship ready. There's the numbers are stored in a database. It's a little different, but the input side and the fundamental outputs, like we still output this spreadsheet. The website looked like this, very high design, obviously. Actually, and it's worth saying that one of the reasons why we didn't launch with some fancy dashboardy thing was the accessibility problems that we saw there. We wanted this data to be accessible to everyone, and the farther you get away from flat HTML, the harder it is to make things accessible. Now the website looks like this, or it did until this week, and the impact that we've had is pretty incredible, and not what we anticipated. We thought we'd only be in business for maybe a week, maybe 10 days, which was hard enough, to be honest. I mean, keeping it when we first founded, the idea of keeping the spreadsheet updated for 10 days was basically impossible. But we brought on enough volunteers, we built out the pyramids of data entry, we did a lot of things, and here we are. We've created the only time series for testing hospitalization and race and ethnicity data, been cited pretty much everywhere, including by the White House itself. Data feeds into different components of the Johns Hopkins tracker. I show this only to show the way we've been a force for reality. Our data's, this is just 2 days worth of citations in other media sources, and even this is incomplete. My mom literally puts together this spreadsheet. That's how hard we pulled on every volunteer. We've distributed among governors. We know we're used by modelers within the government as well as people outside of it, like the site put together by the Instagram co-founders, which is called RT Live. Most major newsrooms are using our data. This data has gone a long way. Sometimes we jokingly say we're like the pirate CDC, and we're not the real CDC, though, and we couldn't agree more with this sentiment. There's just some things we can't do. We can't harmonize the data in the way that a federal agency could. We can only deal with what the states report. Like that's it. Our methods are limited. Unfortunately, the CDC just hasn't provided this information until literally this week. After 80,000 deaths, we finally get something from the CDC that resembles the kind of thing that we've been putting out, at least the snapshot version. It looks like this. This is new this week from the CDC. This is kind of the exact absence of this is why we started this project. And so obviously we're extremely excited that the CDC is doing this. In fact, we were basically, when we saw this, we were like, okay, we're done. And then we started looking a little bit more closely. From the very beginning, we said that we want we want to stop doing this, and we want to, for a lot of really important reality reasons, we would like there to be one set of numbers, and those numbers should be housed at the CDC. The CDC built a quite unusual reporting and capture apparatus. It's not sort of filtering up from health providers into the states and then into the CDC. There's actually sometimes it works like that, but other times there actually have direct links to hospitals, to commercial test providers and other things. And so what has been created are basically two pretty different data sets. When it comes to case counts and deaths, it's pretty similar. When it comes to total tests and what the states report for total tests, like CDC, the vertical here is what the CDC is reporting as the national summary statistics, and the horizontal axis is what we've captured from the states. So this is what the states know about themselves versus what the federal government says about them. And there's some really quite important discrepancies there, which you can see here. This is on a percentage basis, but the absolute differences in some cases are quite large. Like for the state of Florida, the federal government is reporting a couple 100,000 more tests. Some of that can be explained by slightly different methodologies. Like I mentioned, the people tested versus specimens tested stuff, but it doesn't come close to closing the gap. For us, we would feel comfortable switching over if we could get these gaps to be like under 10%. And I think, one of the most important problems here is like the federal government should probably not know more about testing in the state of Florida than the state of Florida itself. It's a really odd situation. Like, it would make sense if the federal government knew a little bit less than the states, perhaps because its reporting is mandatory in the states. In fact, reporting is all tests are mandatorily reported to by an emergency order to the state of Florida. So for us, keep asking ourselves, where do these extra tests come from? Because every company and every hospital and everybody is supposed to report every test to the state of Florida. So where could these other things that the federal government reports be coming from? So we have to shake down a lot of those things. We're going to have a white paper out on this data issue probably by the end of today, for people who are really interested in sort of diving into what the CDC data looks like and what the state data can tell us about that CDC data. I want to end just asking, I'm just riffing here because honestly, I've been deep in the operational part of running this thing. And I want to just talk about, what kind of journalism is this? It's certainly like nothing I've ever been a part of. Everyone from the different realms of our team, data scientists, public health people, comms folks, journalists, no one's seen or been a part of an operation like this. I tend to think that the reason the team looks like it does is this is actually what's necessary for this moment. And so as people have come into the project and seen a need, they've sort of plugged that hole. And then when you step back and you look at like, oh, well, what's plugged into this thing now, that's actually the shape of what you need to get a hold of this kind of pandemic hyper object. And it is a lot of the traditional tools of journalism. The way I think about journalism is I think of it as a series of kind of evolved methods and principles. We tend to think of journalism as sort of paused in time, like, okay, journalism is, a set of outputs, print things or stuff on television or whatever, but it's really a set of guild values, about the importance of truth, about the importance of openness, about the needs of the public to understand what's going on. And then it's a lot of tools, basically, that people, in the 19th century and into the 20th century kind of developed to increase the quality of information that they were providing to the public within this sort of quite competitive sphere, but not totally competitive sphere, particularly of the big daily newspapers and large magazines. So that means, checking people's work, so that we have double checkers that act sort of like fact checkers from the journalism world. It means like standing behind the data or information that you put out. It means correcting it when you get it wrong and correcting it as fast as possible, even if it's embarrassing and hurts. And it's a dedication to the quality of the information that you're putting out. Of course, all those things intersect at a somewhat oblique angle with the larger discussion around what journalism is, fake news, quote unquote, and the different ways that, information, and in particular, the talk about the mainstream media has been weaponized in this country. For me, I think there's the best response is to put out this data, because people need it. And that means that different types of publications, different types of television stations, whether it's Fox News affiliates or it's MSNBC, have used this data because they need it. And I don't think that kind of raw, well, we provide a great utility, and so therefore, we've overcome the deep political chasm of this country. Like, I'm not that optimistic, don't get me wrong, but I think that we can push people towards a shared reality. And I think for for us, perhaps the most disturbing thing to see is that as the death count began to go up, we saw many, many, many people on the right and the far right beginning to try and destabilize that number, and beginning to say that it was inflated as opposed to undercounted, as most experts believe. And one reason that we really find purpose in what we're doing is that our openness about our methods, our openness in what we're doing, I think helps to counteract that sense that, you know, a number is descending from on high, and that's where, and that can be attacked on its own. You know, we can say, look, in order for, you know, here's what we're doing. Here's the numbers. Here's the probable deaths. Here's the confirmed deaths. You know, and we can just sort some of those things out, which helps to, it doesn't stop conspiratorial thinking. It doesn't stop that kind of motivated destabilization of important truths like we've seen, you know, in climate science is just an area where this has happened so often. But being able to be open and being able to be clear about both what is known, what is unknown, and what the bounds, what what that bounded range tells us about the outbreak. Because at the end of the day, no matter how the quibbles about how deaths should be counted, many, many, many people have died. And the basic story of this outbreak in this country is the same. This is a dangerous virus. Lots of people have died. The US response was bad. And there's really no way around those things. And that's one reason why people have tended to quibble. And, you know, my first book, as you mentioned, was called Powering the Dream. And there's a lot about green technology, climate, the climate change movement. And one of the things that you saw there is exactly what you see here, which is basically if you overfocus, once people don't want to believe what's coming out of the scientific community and public, you know, and other authorities, they start going after the, you know, details of these models. When the models are just one piece of decision making and I don't think really change the picture here. So I look forward to taking questions from you all. I hope that you believe, as I do, that we have been a force for reality. And I really, really look forward to getting to the bottom of the state and CDC discrepancies and throwing our weight behind the CDC numbers as soon as our data users feel like they can trust them and we have sufficiently checked them out. So thank you very much.
Thanks so much,
Sure.
Alexis. That was a fascinating view into the complexities that underlie what seems like a simple output. And thank you so much for all the effort that so many of you have put into this. I'm curious what we as scientists can take away from that last riff that you gave as you described it. So there's so much complexity and nuance, and I feel like things are moving so fast with this epidemic that we're kind of seeing the scientific method play out in real time and more in preprints than before, more in press releases than before. What role do you see scientists playing in sort of communicating?
Yeah, you know, one reason that we wanted Trevor Bedford from Fred Hutch up in Seattle on our advisory board wasn't just because you know, we were extremely impressed by the science that he was doing and Next Strain, but because he was so good at communicating both uncertainty and what we do know. And, you know, right now I think he's more important than ever as new narratives take hold about the clinical importance of these different strains that have been identified by genomic analysis. And because I think, you know, that narrative goes to support that the U.S. got hit by a worse kind of virus, you know, and that it wasn't a sociological problem, that it was a virological problem. And I think that's really interesting. And I think obviously all the science should be done to understand that. It's just really interesting though, how I've been on television with people where they just declare that the strain in New York was worse than the one that hit China. And that's why New York had such a hard time. And I just don't know that we have the evidence to support that yet. And I feel like Trevor has been extremely good, both at putting out, you know, the openness of Next Strain to put out this data, but also the ways of constraining the way that the conclusions that people draw from it. And I think that's that's an extremely important part of communicating here, is being able to be open, to allow people to probe and investigate, but also to say what the data doesn't say. And, I'll give a really dumb but obvious example. We see a weekly cyclicality to the data because of just the work week. So over, usually on Sunday and Monday, the numbers are really low. So every Sunday and Monday, when the numbers were low for several weeks, we were, for maybe 6 weeks, everyone would be like, okay, phew, we're over it. We've gotten past it. And then Tuesday, there'd be this huge spike because of the sort of backlog of, in particular deaths that were coming in to the different states. And so, every Tuesday, you'd see other people going, see, it's getting even worse. This is the worst, and you kind of want to be like, listen, guys, look at the chart. Remember, as you're looking at this, there's weekly cyclicality to this. We know that this exists. This is a known phenomenon. You should be expecting this, but don't declare the bottom on Monday, and don't declare, a new phase of badness for the pandemic on Tuesday. I mean, this is just not how this should be done. And so I think that's one of the big lessons. I also think, scientists are extremely good at showing the ways that they emphasize and discount different types of evidence, and build, models of models, or, find ways of quantifying uncertainty. And I think, the concepts, maybe not the math, but sort of the concepts of confidence intervals and upper and lower bounds, and those ways of speaking and understanding this data are also really important.
How does that compete with clean messages that may be less based in that degree of reality? Like, how in the current media market do we?
Yeah. Yeah. I will say, I'm going to step outside a little bit of my sort of boundaries here, perhaps, but I will say that I've been slightly worried about how tactical many public health people have tried to be. There was a big article by Charles Duhigg about, in the New Yorker, about the messaging that different people tried to do. And a lot of the messaging was sort of like, well, if we say this, then the people will do that in a little while. And yeah, sure, people probably should wear masks, but we don't have enough right now. And so we'll just say, hey, you don't need a mask. And then down the line, you'll say you have to change. And to me, the mask thing was just a huge moment of erosion of trust, because, the Asian health authorities were like, what the hell are you guys talking about? and I just feel like, I believe that we should say what we know, and that we shouldn't be too tactical about, well, we're saying this so that people will do that. I think we should say, we're saying this because this is what we know. And if you look at, leaders like in New Zealand and other places that have had a lot of success bringing their people along here for quite intense measures, I think oftentimes it's because they just said, listen, here's the deal. Here's what's going on. And there can still be a clear message, even with the uncertainty. And I think one key thing that I think often is lost in climate debates too is the uncertainty doesn't just go one way. And one thing that happens is the sort of mainstream scientific consensus says, like, here's the thing, here's what we believe, there's this uncertainty. And then, the same network of people on the right, and I don't want to make this a partisan issue, but in fact, it is in this case, both climate and in COVID-19, the right then exposes all the uncertainty that would make things better. And very few scientists are willing to talk about the bad uncertainty. Well, it could actually be worse than what we're saying. And I think leaders who can be clear about that uncertainty has two sides. And not just sort of let the discussion begin at sort of the scientific consensus and then get eroded down, but just point out, listen, there's also this side. I think that actually helps counterbalance. And a really good example in COVID-19 is, excess mortality from New York tells us a lot. And that's not counted in the death number. So you've got all these people attacking the death numbers from below, saying, oh, this is inflated, this is inflated, this is inflated. Whereas established public health methods actually tell you the exact opposite, and that in fact it's undercounted. And we need to make sure that that message is out there, because I actually think the erosion of stability of that death number is probably one of the key political problems for the entire United States, because it's what a lot of people out there are using to judge the severity of the outbreak. And if you have two groups of Americans who believe that a vastly different number of people died, then you have two different realities, and we cannot let that happen.
Alexis, can I jump in with a question?
Mm-hmm.
So as scientists, you can imagine it's particularly painful for us to be watching data be distorted for political purposes,
Mm-hmm.
right? As you know, as scientists, when we present a result, we always, try to, couch it with all these caveats and nuances. You have to appreciate the complexities of the data,
Mm-hmm.
how it was collected. In this case, some states which are sampling heavily in nursing homes, numbers may be higher than other states, right? And how it's collected.
Mm-hmm.
There's all these complexities that makes it really painful for us to watch what's happening.
Yeah.
What is your perspective? Because you're putting this data out there, but
Mm-hmm.
you're also knowing that there's this risk that people are going to use it selectively for political reasons.
Mm-hmm. Yeah, we do. I think that I think that what we have decided is that if we properly signpost this data and we say, listen, you can't use it this way, and here's why you can't use it this way, and then people use it that way, then we can say, hey, listen, we said it's not that we're telling you specifically you shouldn't do it this way because you are trying to make some political point. We're saying, here's the problem with using the data in this way. That's been our main line of defense. I think our other line of defense is we are trying to reflect reality. Again, I know I keep coming back to this, but this is what we're able to put out as our closest reflection of reality that we can find. And if people want to try and distort that, it's fine, because the next day we'll just put the data out again, and the next day we'll just put the data out again, and the next day we'll just put the data out again. And in many ways, I think the core sort of meta point of this project of providing accountability both on the government side to begin to put out this data, which we feel is a big victory for us, but also to just provide this sort of metronome of like, listen, here's what we know, here's what we know, here's what we know, here's what we know. And, when the data looks good, we say like, hey, positive rates are going down. This is a good thing in lots of places. When the data looks bad, we say, hey, look, this is this. And over time, you're able to develop credibility within these different social spaces that are out there, because this knowledge is going out into these different social networks, and you have to understand how they work. And that has been a part of our communication from the very beginning, is the understanding that we're not going to take the bait on anything. We're just going to keep putting the data out and keep putting the data out, and understand that if the data is great, we'll say that. And if it's not, we'll say that.
How have the various public health departments reacted, both from the start, and then how has that evolved over time to your efforts to reach out and tabulate?
Yeah, I'm not sure that any of them love us. I don't know that any of them hate us either. Well, maybe some of them might hate us actually, but it's been really interesting when we put out a new state grading system. Almost immediately, governors started to talk about the grades that they were getting in their press conferences. First Rhode Island and Oklahoma and other places. One thing we've made sure to do on this score is to call out when, regardless of the governor's political persuasion or even just what they're doing in their state, if they're doing a good job doing data reporting, we say they're doing a good job data reporting. And I think, oftentimes that's gotten us into some trouble, because some people haven't liked, for example, what's going on in Florida, but Florida's actually doing a pretty good job on its data comprehensiveness. And so we say that. I think for us, that's part of being that kind of honest broker. Yeah, I mean, I think the states that get a really good grade, I think their public health departments like us, and the states that get a bad grade don't like us. I think in particular, Nebraska doesn't like us because we've been putting all kinds of pressure on them from all kinds of different angles to release race and ethnicity data because they have a lot of meat packing. We know that's disproportionately impacting people of color, and they haven't released any of that data, even though they agreed to do it some weeks ago. So, because local reporters have asked. So, the point isn't, as they say on reality TV, we're not here to make friends, but we also do want to have productive working relationships and not be unfair to authorities that we know are working really hard.
Did you anticipate from the beginning folding in racial data as soon as it was available, or was that in response to what you were starting to see in terms of early trends?
Yeah, we, honestly, in the early days, we had no idea we'd be doing anything, in May. So it would have been hard to say we anticipated that. I would say that it was our first place we were looking as we started to see it show up. In part just because I read all of Ibram's essays, and so I knew that that's what he was thinking about, and I knew that the second he wanted to do it, we were ready to go. So I think it was something that we saw as a really important part of the outbreak. I mean, in part because, I'll just say this, I'm like kind of a science and technology historian by avocation, at least. And if you look at the late 19th century and you look at what happened with disease and fire in particular, there's a historian at Stanford named Richard White, who talks about what he called the democracy of defecation, that essentially you could not build a safe city that didn't protect all of its residents with certain types of basic infrastructure. You needed water, you needed fire departments, you needed sewer. This is how the great American industrial cities were able to grow. They realized that the city was really a ship and that it was going to sink or sail as a whole. And I think my hope is that this moment for our country is that what that moment was for the cities. And I just think if you look at what it really unleashed in America, it was the great American cities were able to grow because they solved this problem of disease in a way that was fairly equitable, obviously not perfectly equitable.
Last question, Alexis, because of time, and that
Sure.
is that what do you see in the future? Do you think that this is going to set a new precedent for, for journalists, for the media to actually, create these databases? And, it's
Mm-hmm.
almost merging with public health, but you can imagine it in almost any arena of life.
Yeah, I think, if you look at some of our forebears in this kind of work, like ProPublica, or, what the New York Times is doing with county data, I would say this, I bet nobody has a better county case count than the New York Times. So, you're talking, some of the most important data is already coming from two different news organizations. We've also seen ProPublica do this many times, and data journalism has been something that people have talked about for a long time. What I really think is allowing the freedom and space for the shape of institution that's actually necessary for a particular moment to emerge is really what I think is important. I don't think it's the exact form of what we're doing. I think it's that, my bosses at The Atlantic and other people who've worked on this project were willing to let this thing be what it needed to be in order to come to this moment, as opposed to trying to take previous forms of putting out information, previous organizational forms, and trying to use that to report. Because some of these unprecedented circumstances, they just require other forms. And, I would say you can look at something like Syria Deeply, or some of these other, which was by Lara Satrakian and her sort of another journalist. There are sort of precedents for what we've done. I think the unprecedented thing is that we created something that normally is only provided by a government. That's actually pretty weird. And to be honest, I hope that doesn't set a precedent for the future. I hope that this isn't something that we encounter a lot, and that this can just be something that happened this one time because of a bunch of weird circumstances and the sort of sui generis nature of the pandemic.
Well, thank you very much, Alexis, for your time this morning and so early in the West Coast, sharing your insights with us, and even more so for all your hard work and those of your colleagues over the past few months. We really appreciate you coming. Thanks to everyone who's joined us for the past few weeks to this seminar series.
Thank you so much.